Well, welcome back, everybody, as we are hosting from our homes today, continuing to bring you the Morning Blend. And this morning, it's time to focus on seniors and how important those primary care doctor visits are. But again, I know a lot of people have some questions. That's why we are happy to bring in MyCare Medical Group this morning. We have two guests from their wonderful team. We have Dr. LeBron, who we're going to talk about how these visits are working right now. And then we also want to welcome to the show and also to MyCare Medical Group as well, James Dubois, who's the new VP of Sales and Marketing for the team as well. So good morning to both of you.
Good morning.
So Doctor, let's start with you, and we're going to ask you a couple questions, and then James will come to you and talk more about the team and welcome you to the team as well. But Doctor, talk about these primary care visits. And like I said earlier in the show this morning, we have seniors in our family, and we know how important it is to make sure they are staying in communication with those primary care doctors. Talk about why that's important.
Well, right now it's really important communication because we have a lot of information. The internet, television, radio is overload of information. The patient is going to have questions that only their PCP can answer. We know our patients, we treat them, and we have a relationship with them. So when they have a particular question to us, we can give them a really good answer and give them peace of mind and be safe around. So it's important that we can clarify all their doubts. That's what we're here for. Keep hand to hand with our patient on time of crisis like now.
Well, and talk about that, because I think rightfully so, seniors might be a little nervous to make that trip to the doctor's office. I mean, that's where you're hearing is obviously if that's where other people are going to be sick. How are you guys minimizing that contact with other, people in the public and making sure that those visits are staying safe? Have you guys changed what your team typically does?
Yes, right now technology is being our friend right now. So we're doing basic. First thing, the patient contact to the office and request a telephone appointment. We schedule the telephone appointment. We call the patient, and they hear a familiar voice. They hear the provider's voice, and that helps them get at ease. We go to the consultation with them on the phone. Now with technology, we got the laptops, tablets, and the smartphones, so they can do a video chat the same way. The patient requests a teleconference with the doctor. We schedule them, we call them, they agree to it, and I can see them. They can see a familiar face. They can see their doctor right in front of them. So they feel more at ease. They feel better, and we can talk about things, discuss results, and I can see the patient, and that's really convenient. And lastly, we can see the patient at the office. We increase our safety measurements at the office. We have to prepare the place, and we receive one patient at a time, because there's some things that we have to do ourselves. We have to fix things. We have to evaluate the patient. That has to be face-to-face. So we have different options to keep the patient on our reach, and we can provide the service.
That's great, Doctor. Let's go ahead and bring James in too, because I would imagine that this new way of kind of operating business and seeing new patients and seeing the patients before, what has that reaction been like? What's the feedback that you and the team are getting, James?
The seniors are very excited. They're reassured, as Dr. LeBron said, to speak with their physicians. So any opportunity they can get to speak with their physicians to maintain their health, because this is a trying time for them. They're afraid to go out and they want to avoid public exposure, but they need to maintain their health. That's the most important thing they can do. So they have responded very well to this, and we're very happy. MyCare Medical is quality care that follows you everywhere, and we're fulfilling that promise by meeting them wherever they happen to be to keep them healthy.
Is the reaction, because sometimes, just like with anybody, I don't want to pick on seniors this morning, but sometimes when you've been doing things a certain way for quite a long time, you want to stay that way. Or if maybe a senior doesn't have somebody who can maybe help them, teach them these new ways of, doing the telecommunicating or whatnot. How has your team been able to help?
Well, that's a great question. Change is hard for everyone, no matter what age you are. And what we have a team of people that are actually very technically competent. And so if you call us, we'll have somebody walk you through. If you're afraid about the technology, we'll have an individual car come pick you up and bring you to our center if you need to, or you can simply just talk to our doctor over the telephone. But we do have a team of individuals that will help you overcome any technological challenge that you may have so that you can communicate with your doctor. At the end of the day, we want to remove every barrier we can to ensure that you can talk with your physician.
I love that. I love that. Well, let's bring the doctor in, because I want to get his final thoughts. We have a little less than a minute left. But Doctor, what do you really want patients to know and the senior population to know when it comes to these well visits and making sure that they are getting the care and these appointments, keeping these appointments that are really needed?
Don't hesitate to call us. We're here to provide a service, no matter which way, telephone, video, coming to the office. We're
Yes.
here for them. We're working hard. We're being the best we can to provide a service so they get all their needs, supplies, medication, refills. We're just here to help them, and they're always welcome. And we're doing our best, and we're waiting for them to be part of this.
Well, and I apologize I didn't say this earlier, but doctor, thank you for you and your team and the medical staff. Again, you truly are healthcare heroes, and we appreciate all that you are doing for our community.
Thank you very much.
James, thank you so much. Welcome to this wonderful team. We've had the pleasure of working with MyCare Medical now for quite some time. We know you have a great team, and we look forward to talking again and seeing how this is going to maybe change the medical field kind of in general, and seeing how your team adapts like everybody's having to.
Thank you, Carly. Happy to be here.
All right, we'll go ahead. There is the website for you to go to find more information, the number to call as well. And again, we just want to thank all those healthcare heroes and all the healthcare medical staff that are continuously changing how they operate to keep us safe. So we really do appreciate it.